Hey, I'm Dr. Jason Lofton here with Dr. Randy Walker and Dr. Philip Glasgow, and we just wanted to come to y'all just to talk about masking. There's been a lot of questions in the community about that. We're seeing a lot of COVID cases recently, and so Dr. Walker, I'll let you start off just talking about what we're seeing and what you're wanting to discuss.
Well, I think the most important thing to consider now and why masks are so important is because our healthcare system is becoming overwhelmed. We're trying to send people to local hospitals, and often the closest hospital they can find is in Illinois or, the eastern United States. So it's not that masks are the be-all and end-all of, and they're not 100% effective. They're probably actually around 50 to 75% effective if, just to be truthful. And the way masks help is to stop droplets that can float on the air. They're tiny little droplets. And they don't stop all of those droplets, but by decreasing the concentration of those droplets in the air, it has the same effect as achieving a higher vaccination rate. And I think we can all agree that these new variants that are coming out are, 4, 5, 6 times as infectious as the old Alpha variant was. So with the Alpha variant and its limited ability to spread from person to person to person, it made sense probably to, not wear a mask because it would be impossible for the virus to spread through a community. But with these new variants, they're more deadly to younger populations, and they're so much more infectious that we have to do everything we can to stop the spread, which includes masks, includes social distancing, it includes vaccines for everybody.
Yeah, and Dr. Glasgow brought up a point. He's got some young children, and just let him talk about just his thoughts on that.
Well, I think that a reasonable approach, because we're here to discuss really masking in the children in the schools.
Yeah.
That's really the issue at hand. And I have a daughter starting kindergarten in a few days. I don't want her to have to wear a mask, but it's clear that we have to take some steps to mitigate the spread of this virus. We've seen a ton of it lately. We've seen sick people every day with it. People are dying in the community. I think that a reasonable approach is for adults in the community to buck up and get the vaccine and get those numbers up so that we don't have to mask our kids.
Right. Yeah, and masking works. I had a patient this past week ask me, do the masks really work? And last year, I can say yes, because last year we saw hardly any flu. I think I had 2 cases the entire season. We are seeing some now, but we haven't been wearing a mask this summer. And so when we get the mask on, it's like shutting the door, trying to prevent things from either coming in to us or going out to others. And we want to encourage that, even for when school starts, until we get our vaccination rates up. I'm going to encourage people to strongly send their kids to school with masks on. I have 4 children. 2 of them have had the vaccine. 2 of them aren't eligible yet. It'll be later this year before they're eligible. And so I will ask my kids to wear a mask, and unless, in their classrooms, if they can spread out and take their mask off and socially distance, that's fine. But when we're in congregative settings, whether it be in a school, classroom setting, bus, cafeteria, you need to think about, we can take our mask off to eat, but in between we need to think about wearing a mask and really encouraging vaccinations for those that are eligible.
Yeah, and I would just say the goal here is to try to keep from overwhelming the healthcare system, which we're on the brink of doing that right now.
Yeah.
And it's not just for COVID patients. If you're in a car accident, if you're having a heart attack, it's often hard to find a place to take those patients.
Yeah.
And it's not that masks are perfect. I mean, a lot of the stuff you've heard about the droplets leaking out of masks is true, but they do decrease dramatically that concentration of virus in the air.
Yeah.
And they effectively increase the vaccination rate.
Yeah. And that's all, we put filters on our air conditioners.
Right.
Everybody's got one. It catches particles, and masks did the same thing. I talked with a surgeon in Little Rock this last week. He said he was seeing somebody for appendicitis in a hallway. They didn't have rooms. And ER doctors are saying they're having patients that are having to sit. We have our ambulances getting tied up in the hospitals because they can't get a patient out of the ambulance because there's no beds in the hospitals. And so if we take these measures, it will help us decrease decrease the amount of people getting sick and having to go to the hospital, and open the beds up for those that are having their strokes and their heart attacks, and getting appropriately fixed.
It's hard for humans to think exponentially, but if masks are only 20-30% effective on the margin, when you start multiplying that number by itself, you can go 2, 4, 8, 16 instead of 10, 100, 1,000, 10,000, 1 million. So the mask just on the margin will make the likelihood of having an epidemic that overwhelms the healthcare system much less likely, even though they're not a perfect solution.
Yeah. And we're in a tough situation here without a local hospital. Our ambulances are having to drive further. They're getting tied up, and we just want to do what we can to limit the spread, limit the overwhelming process in the hospital, and keep you guys healthy.
Right.
Dr. Glasgow, anything else you want to add? I'm glad to have you here, and if y'all haven't met Dr. Glasgow, y'all can meet him at Dr. Walker's office. And if you have questions, we've got Facebook, call the offices. We just want to see everybody stay healthy. We want to decrease the number of deaths, want to decrease cases, and just have a great school year.